Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. If you'll go ahead and go to the first update. So HHS has done a slight reorganization, which includes renaming and slightly expanding the scope of ONC. We will likely still call it ONC just because, as you can see from the slide, the new name is Assistant Secretary for Technology Policy and Office of the National Coordinator for Health Information Technology. So it's actually ASTP/ONC, and I assume everyone will still use ONC for short. I will note it's a little bit, in addition to being a mouthful, it's a little bit of a strange construct because this is the office name as opposed to the name of the so in the past we had the national coordinator and then the office of the national coordinator, and what we have now is the office holder and the name of the office kind of merged together. So that's going to take a little bit of getting used to, but in any case, that's the official name. There are some changes of scope and responsibility around that, as well as a minor change in other areas. Basically, as part of this change, all of the HHS oversight over technology, data, and AI policy and strategy is going to move into ONC. There are 4 new offices and 3 new major roles at a high level over 3 of those offices. So there's the Chief Technology Officer with the Office of the Chief Technology Officer. That's a little bit of a shocker. They did use this kind of normal naming scheme: Chief AI Officer, and Office of the Chief AI Officer, and Chief Data Officer, and Office of the Chief Data Officer. So they're basically what it looks like they're doing. And then there's also Office of Digital Services. It is not clear if the Office of Digital Services is kind of an internal offering digital services to HHS, or if that is a office overseeing industry digital services around healthcare. The other 3 offices, as you can see, they kind of just split up technology, AI, taking AI separate from technology and data, and sort of gave them a place to sit. So I assume things like USCDI, they haven't made any specific announcements about this. This is just me speculating, but presumably things like actual data standards, USCDI, some of the other things, USCDI plus some of the other components that are strictly data will fall under the Chief Data Officer's bailiwick. Things like general adoption of standards and interoperability under the Chief Technology Officer, and then obviously AI under AI. And I would assume they're probably going to put other decision support, all of decision support under the Chief AI Officer, but again, this is just me speculating. So that's kind of the major change for ONC. And then as part of the same change, the 405D cybersecurity program, which we periodically talk about and provide updates from, is moving under ASPR. I forget what ASPR stands for, but basically it's moving wholesale from one part of HHS to another. So they didn't note any expected changes to the program itself, but just that it's moving its official location. So you can find more at this press release, and there are some offshoots and additional information available from there. Any questions or thoughts or comments there? All right, then next update, please. So CMS has issued a new guidance letter on provider directory requirements that come from the budget bill, from the 2023 budget bill that was passed in December of 2022. There are some variety of provider directory requirements that were a part of that bill. As you know, they have a tendency to put specific healthcare interoperability, health data things into those budget bills, and this was one that was part of that one. So some key things they point out is that, and so this would be mostly for Medicaid and CHIP, that you're now required to have quarterly updates for the fee-for-service and MCOs. They used to be annual requirements. You're required to have additional data in the provider directory, including what accommodations are available for disabled patients at the office. You're now required to have the website of the provider, availability of telehealth. This one's interesting. It's not just whether new patients, but whether new Medicaid or CHIP patients are accepted, and then what cultural or linguistic services are available. And they specifically call it American Sign Language, as you have to specify whether or not ASL is available. We're going to continue on to the next page, but any questions or comments so far? All right, let's go to the next slide. So they also explicitly list out the provider types that must be included in the directory, and they specifically call out physicians, hospitals, pharmacies. They separately call out mental health providers and substance use disorder providers, as well as long-term care providers. And then they say that additional providers can be mandated by HHS. One of the other things that was interesting was that they remind folks that many of these plans fall under the CMS rules for the provider directory API. And just as a reminder there, that actually requires a FHIR-based API that is plan specific with no authentication so that a patient or someone else, someone who's looking to plan shop or do whatever, can determine the status of providers in that directory. The data requirements of what must be included in that API are not as strict as what must be required generally based on this set of requirements, but the API itself is still in play and must still be done with all of its assorted requirements at the same time. The guidance letter also talks about enforcement not being in non-compliance and correction plans. I didn't go into detail on that here, but if you're interested in more about that, you can find the full guidance letter. I think it was about 9 or 10 pages long at that link. And just as a reminder, since it was on the other page, the new rules go into effect on basically a year from now, on July 1st, 2025. Any questions, comments, thoughts there? All right, then let's go on to the next update. All right, so CMS has finalized the Part 2 guidance on the prescription drug payment plan. Those of you who've been attending for a while may remember that we reviewed Part 1 last year, and this is the plan that allows Medicare patients to spread their Part D or Medicare Advantage drug payments out across the full plan year, even if they actually have the charges happen earlier in the year. And so that first Part 1 guidance was around the actual payment plans, and that's what we commented on. The Part 2 guidance deals more specifically with education and outreach efforts and requirements in those areas. And so they talk about things like requirements for what has to be part of Part D member ID card mailings, what has to be on websites around this program, other mailings that you're required to send, etc. Also, requirements around plan election options and things like what you can and can't say about payment of money owed and when it's allowable terminations and stuff like that. We got into some of the removal and termination rules for part of the Part 1 in terms of the actual rules themselves. This is more the guidance around how you can communicate those things. And then also a bunch of information about what CMS intends to do around education and outreach for this program, including things like fact sheets and webinars and stuff like that. So there were 2 big changes that they call out from the proposed rule. One of them is interesting. This seems to be a trend for CMS, where they're not mandating a standard way to do something for certain things, but they're allowing the plans to develop their own methodology or rules or decisions on certain things. And so this is I don't know that that's necessarily um a good way to move forward, but that seems to be the direction they're moving in. And they did it here as well, where instead of having some rules around how to determine which patients will benefit from enrolling in the program and therefore need to be part of outreach, they're allowing the plans to make their own rules around that. And then they're also requiring plans to include the enrollment forms for the prescription drug payment plan in either member ID mailings or separate mailings that occur at the same time. So any questions or comments or thoughts there? Okay, that link goes to a press release, and that press release includes a link to the full guidance if anyone's interested. All right, let's move on. ONC has released a new e-prescribing test suite that includes a variety of testing tools for NCPDP standards, and as well as a link to a Google group that they established for general public discussion around e-prescribing testing. So you can find more information at that link. That link basically goes to a place where there's boxes that lead you to the information and specific testing for each of those areas, as well as information about the Google groups. Any questions or thoughts or comments there? All right, let's move on. Also on the testing front, ONC has updated their real world testing guide. This is the guide. This is part of the requirements for any API certification is real world testing. And they weren't clear about what they updated versus what was there before. So the content of the guide now includes, presumably some of this information was there before and some of it is new or changed, but it now includes an introduction that talks about the purpose of the testing, terminology, and other basics around the guide. Actually, the purpose of the guide, terminology being used, and other basics. And then the second section is actually the purpose of the testing and other additional information about the testing, including how it works, followed by information on test plan requirements and justifying their approach. And then the last sections are on specific technical details like standards updates and the measurements and metrics you need to use. And then they end with an appendix that includes a bunch of scenario and use case examples around real world testing. So if you're interested or involved in any of the real world testing for ONC certifications, you should go ahead and take a look. That's the updated guide. It was updated about 2 weeks ago. So any questions or thoughts or comments there? All right, next slide, please. Excuse me. So CMS has also put out an oral health information about an oral health initiative. This came out of the CMS strategic plan that we reviewed as a group. Some of the major components of the initiative. This document is really a fact sheet about the initiative. So what the document that I point to is sort of talking about some of the benefits that patients have gotten from being enrolled in Medicare or Medicaid or Marketplace plans to their oral health, and then a bunch of available data and analytics around oral health. And some of the things they included, in addition to reports, they did point out a few actual public access data sets for those of you who may be interested in looking at data around oral health, either utilization or some of the or access or things like that. And so I don't remember off the top of my head which of the items that I listed in that last bullet were reports versus public data sets, but they did have some of both. around those topics. Any questions or comments or thoughts there? All right, if you'll go to the next slide and pause there for a moment. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.